Hi, I'm Dr. Connor McClenahan, and I want to talk with you about why anxiety is difficult to manage. Why doesn't it go away? How come when we take deep breaths, when we exercise, it goes away for a minute and then it comes surging right back? Sometimes we worry that maybe this is just genetic or the way that I am. Maybe I can't change this. Maybe I'm not doing enough. Maybe I'm not exercising enough or deep breathing enough or drinking enough tea or some kind of antioxidant to help me in some way. And we can get stuck on these loops sometimes of just playing the game of whack-a-mole, of trying to make the anxiety go away. And that's often because we don't understand what's actually happening inside of us. We don't understand why the anxiety is there. Now, usually we think of the anxiety as maybe I'm just worried about the presentation I have coming up or the in-laws that are coming to visit or something like this. But if we only understand the surface of what our anxiety is telling us, then we're always stuck in trying to suppress it. And whenever we suppress it, we get stuck in a cycle of having to push it away, and then eventually it comes back, just like the tide goes in and out. And that can be really frustrating. The other pathway that we could talk about that I want to explore with you here is, instead of pushing it away or pushing it down, to think about it as, how do I pull the anxiety closer toward me? And this involves treating it almost like it's a child, right? A child that's crying, something that feels frightened, that needs help, that doesn't understand what's happening to it. Maybe this is kind of what you might be able to identify if you slow down for a second, that there's a part of you that is really worried and you don't know why. And until we can actually pull it in close to you, we're going to be stuck in this game of suppression, and then it's going to surge back. Suppression, and it's going to surge back. So the opposite direction there is to pull it in close, which means exploration. It means listening to your anxiety. It means understanding that there's probably some layers to what you're afraid of, and that if we drop down step by step, there might be something relieving or alleviated by just being able to pay attention to what the fear is. Often, the fear doesn't have to just do with our current circumstance. It has to do with things that we're afraid of happening again. If you think about things that have really scared you in your life, places where you've been really unsupported or frightened or worried, times when things really didn't work out and you needed more help, often we're afraid, our minds are afraid that that exact situation is going to revisit us again. And when we can slow down to understand those things, something releases, something is alleviated. And that's a process that we help you with in psychotherapy. So if you're somebody who feels panic attacks constantly, or chronic pain where you feel tense all the time, or you're waking up at night, these are ways that your body is telling you that you need more than just better diet or exercise. You're needing understanding. You're needing a deeper understanding about who you are, what you've been through, so that you can release what you've been holding on to and actually feel comforted. That's what we want for you. We're here counseling. We have therapists here in Pasadena who can help you grow, who are specialized in treating anxiety. We have in-person appointments, and we're here to help.